it forward now to Elisabeth, who is kindly speaking to us from Norway, who is from Bergen. I'm going to post Elisabeth's details in the chat so that you can find her, but she's going to tell us a little bit about the acute alerting effects of light, whereas you've just been speaking so fascinatingly about some longer term ones. So over to you now, Elisabeth. Thank you all again.
Thank you, Shelley. Can you guys hear me all right?
Perfect.
Yeah. That's good. So thank you for the introduction, Shelley, and also for putting together this great meeting here today. Today I'm going to introduce the ongoing project called nLight. So it's exploring new and optimal light conditions to improve cognition, mood, and health in people with dementia. So it's quite a tall order there. So my name is Elisabeth, and I work at the University of Bergen, Norway, at a place called Alrek Health Hub, which is a new and exciting place where we join forces from different disciplines to improve, especially primary health care related health problems. Before I introduce the nLight project and the very preliminary findings related to emotional processing in state from that project, I also shortly wish to introduce our last research project called the nLight trial, as this project in many ways both informed and inspired the ongoing nLight project. So our main hypothesis in the nLight trial, which started in 2017, was that light therapy can improve circadian rhythms, sleep, and behavioral and psychological symptoms of dementia in nursing home patients. So very quickly now, nLight was a cluster randomized trial recruiting 78 nursing home patients from 8 different nursing home units as clusters. And as you see, similar to what you saw in the last talk as well, what we really tried to do was improving light with a bright light midday and more blue depleted lower intensity light in the morning and in the evening and night. So this project went on for the 24 weeks of winter here in Norway. And I will keep it brief. So what we did find was a significant improvement in sleep in the intervention group as compared to the control group. Meanwhile, the result was found when sleep was observed by the nursing staff who knew the participants well, not by actigraphy. I'm not going to go into why we think that happened, but we also looked at the behavioral and psychological symptoms of dementia, mainly looking at the neuropsychiatric inventory. And we saw a significant improvement in the total score, but surprisingly, this rather sizable change did not remain significant after the correction from multiple testing. Meanwhile, there was a significant effect of light on the affective, so that is mood symptoms, subsyndrome of that scale, both with and without the FDR correction. And also, when we did analysis with the Cornell scale for depression in dementia, we found a significant improvement in depression, both in the total scores and in the mood-related signs subscales. So, looking at circadian outcomes in this study, analyzing rest activity rhythms from actigraphs, we found a significant difference in the groups in acrophase shift from baseline to midwinter. And interestingly, the control group mean phase was delayed by about 1 hour compared to the intervention group, which remained relatively stable throughout the winter. So this was a significant result, but it did not remain after the FDR corrections. So the main outcome really to improve in this study was the mood-related symptoms. As always, there's many things that we, in hindsight, think we should have done differently in this study, but relevant for today's talk is that the design made it difficult to ascertain what aspects of the light intervention and what mechanisms that were most important for the improvements. So is the most important changes related to acute effects of light or more long-term improvement in circadian rhythms and sleep? So interestingly, the strongest finding was not related to either circadian rhythms or sleep, but to the affective or mood-related symptoms. And these findings and also lessons learned were the basis for the ongoing Enlight project, where we want to look closer on the immediate effects of light on alertness, cognitive performance, and emotional state. So here you see the core group at the University of Bergen. We are currently hiring another PhD candidate who is hopefully starting up this month. So this is good news. And today I'll focus on the second work package, as you see here, and objectives in the Enlight project. So the testing of the acute effects of different light modalities, which was both mono and polychromatic light, on emotion recognition and processing. So we are currently working on a review on this subject, and what we see from the 53 included papers is that there are very few studies on the processing of emotional stimuli in relation to different light modalities, and there are even fewer studies including older adults or people with dementia. So there's a need for looking into this. Thus far, we have mainly included young adults with 30 participants included thus far, aiming for 40 in total. We have just started to include healthy older adults and people with dementia. So this is going to be exciting. Regardless of the group allocation, all participants are screened according to cognitive function and mental health. And they are assessed at baseline in terms of intelligence, cognitive function, personality, chronotype, physical activity, alexithymia, and also they are monitored with actigraphs and sleep diary 1 week prior to and also during the experiment. The latter measurements is to ensure that the participants are have kept a sound bed routine the week prior to testing, allowing them to get enough sleep before arriving at the lab at 8 in the morning. So here you see an example of the complete experimental protocol. The order of light conditions are randomized, as are the order of tests during the experiment. So the experiment spans over 4 days, testing the participants on Tuesdays and Wednesdays over a 2-week period. And before coming to the lab, the participants are instructed to wear these goggles, as you see here, in an attempt to minimize prior light exposure. They also will remain in dim light 1 hour at the lab before the light exposure start, and the subsequent testing commences. So the cognitive tests that we include in this experiment is the psychomotor vigilance task, attempting to measure alertness or vigilance. We have the NBAC test, we have the flanker task, and we also monitor the heart rate throughout the experiment, allowing us to investigate the effects on heart rate variability. So diving into the emotional processing, all the tests were based on the faces database, allowing us to randomly select a high number of different faces and expressions balanced for age and gender. And the participants are tested on these 3 tasks: explicit emotion recognition, implicit emotion recognition, and an emotional go, no-go task. So I'm just showing you an example here of the explicit emotion recognition task, where we ascertain the participants' time to respond to the stimuli, the reaction time, and also to which degree they are correct in their impression of the facial expression they are seeing. They are also asked to rate the intensity of the expressed emotion. So in the explicit task, they are allowed to watch or look at the face for as long as they want to, whereas in this implicit task, the facial expression is just briefly flashed on the screen, and the participants are then asked to choose what expression they think the face might have had. And also here we measure reaction time and accuracy, whether or not they are right. To the go, no-go tests. This is the results I will report today. And this is also used both with and without emotional expressions. So in the regular go-no-go tests, it's mainly testing response inhibition, whereas the emotional go-no-go tests also attempts to measure processing of emotional stimuli, and it also is said to measure emotional regulation to some extent. So in the ENLIGHT trial, the emotional go-no tasks consisted of 2 blocks with 64 trials each. In one block, the participants are asked to press a button when they see a happy face and not press a button when they see a sad face. So for instance, here you would press the button, not press the button, and then press the button. The opposite is the case in the other block. And this is a task that is kind of swift and is considered difficult for many participants. So errors do occur. And the main outcomes are reaction times and incorrect versus correct responses, which may, among others, uncover biases towards positive or negative emotions. So the preliminary results from the emotional go-no-go task, looking at the response time, and I want to emphasize that this is very fresh and preliminary results from the experiment. As expected, the mean age for now is rather young, in the early 20s, as most of the participants this far has been bachelor level university students.
I'm sorry, I'm just really aware of the time. So
yeah, I thought I had 15 minutes. Sorry.
Yes, we're coming up to that. So yes, thank you.
Yeah, okay. It says 11 minutes here. I will be quick.
Oh, I'm sorry, my mistake.
So the results from the repeated measures analysis showed that there was a significant effect of valence, meaning that there was a shorter response time to positive as compared to negative stimuli. So this is quite common. And we have also found a difference between red and dim light with an LSD correction, but not when correcting for multiple comparisons. So looking at the repeated measure analysis, we also found a significant effect of valence with short response times to positives as compared to negative stimuli, as I said, but we also found a difference between red and dim light. You can see here, looking at the interaction between light and emotional valence, that we did see that there were significantly shorter reaction times to positive, seen here in the blue line, as compared to the negative emotional expression. Again, confirming the bias, but we also see the tendency to a significant interaction effect between the light condition and valence. Although only a potential trend with a p-value of 0.6 between the red and dim light, there were where the negative stimuli compared to the positive stimuli had an even longer response time in red as compared to the dim light. So what now? The overall positive bias validated our protocol, as this is what we expected. Humans are generally more inclined towards happy faces. And as I have emphasized, these results are really preliminary, but in a pilot study looking at the response time for the psychomotor vigilance task, we discovered that the participants were not conscientious in keeping a sound bed routine, allowing them to be fully rested when arriving at our lab at 8 in the morning. So in future analysis, we will also add total sleep time. And also we, of course, will look at not only the go-no-go task, but also other emotional processing tasks and outcome. And I'm also particularly excited to investigate further the effects of emotional processing also in older adults and people with dementia. So a significant finding here revealing differences in, for example, processing of negative and positive stimuli according to light conditions could indicate that the light acutely changes emotional state. So taking longer to process negative stimuli in red as compared to, for instance, dim light could suggest the bias away from negative stimuli in the red light condition, which is also something to consider when designing the light conditions in, for instance, nursing homes. And it's also interesting from a clinical perspective, considering the prior and ongoing research we do here in Norway, looking at the effects of blue depleted light on bipolar disorder and also agitation in people with dementia. So I was trying to run through the latest parts here, but this is some images from our light lab. And with that, I thank you for the attention.
Thank you so much, Elisabeth. I'm sorry, we're just aware of such a packed program. It's fascinating work, and very much looking forward to seeing where we go with that. So if people want to read that paper in more detail, is it published yet?
Now, this is preliminary, as I said. So this is, I think it's more fun to introduce that than to introduce all data. But the prior study is all published, so that the effects in the nursing home is possible to read online. Yes. Right.
So it's hot off the press, and it sounds as though lighting can really affect emotional reactions. So that's a really fascinating thing to discover. Thank you so much for sharing that.